let's move on to our next question then here.
Okay, alright, so the next question says, thank you for the video, numbness and pain, troubles after wisdom teeth surgery, Dr. Badville. At 58 years old, I've been experiencing wisdom teeth pain for several months now. Recently it worsened, prompting me to visit the dentist last week. After examining me, the dentist prescribed antibiotics and scheduled an extraction appointment for this Saturday. However, upon reviewing the x-ray, I noticed the nerve is located near the tooth, which has left me feeling quite anxious. Should I consider suggesting a coronectomy as an alternative option?
Well, first of all, thank you for being a loyal follower and watching our video. So what this follower is asking is, she's 58 years old and she needs to have a wisdom tooth removed. And after watching our videos and which explains the complications of removing wisdom teeth when you get older, she's a bit anxious about removing the wisdom teeth because it is getting closer. It is sitting or located closer to the nerve. So what the caller is asking is whether should she consider a coronectomy as an alternative to completely removing her tooth. So what that means is, so whenever you have a tooth, imagine this is the crown of the tooth and this is the root of the tooth, and imagine this is sitting close to the nerve, right? So, or sometimes what we call it as a traversing through the nerve. So what that means is the nerve is sitting here and the tooth is actually going all the way into the nerve. So when it is doing that, and whenever we do procedures as surgeons, we want to avoid risk and complications as much as possible. We don't want to go and remove the tooth just for the sake of removing it and end up having to create complications. And it's like, waking up a sleeping dog. We don't want to do that. So we want to prevent any complications. In those cases, what we normally do is if the tooth is traversing through the nerve, so we don't remove all the way the whole tooth. So we end up actually sectioning the tooth right up here. And what the caller is asking is coronectomy. So this is the crown of the tooth. We just remove the crown, or maybe just a little bit of the tooth, a little bit of the root, and we leave the rest of them inside. So particularly in older patients, anytime patients are about 35 years or older, we normally are very, very cautious about removing the wisdom teeth. Unless it is really absolutely necessary, we do not recommend removing those when patients are particularly older than 35. So if you are a 58-year-old person, and if a tooth is traversing through the nerve, then my recommendation would be to consider the coronectomy, and again talk to your dentist. And if your dentist is comfortable doing that, then just get it done through a dentist, or come to a surgical place like us, and or go to see an oral surgeon or a periodontal surgeon who specializes in removing those type of teeth which are particularly sitting close to the nerve. And they may be able to say, if it is not completely traversing through the nerve canal, they may say that, hey, it is safe for you to remove, although it is closer to the nerve. In that case, I would recommend completely removing the tooth. But if it is traversing through the nerve, which means a part of that tooth is going through the nerve, then absolutely coronectomy, which is removing just the top part of the tooth, which is the crown, is absolutely, I would say, the best option. Again, your dentist or your oral surgeon or a periodontal surgeon should be in a best position to answer that question. Guess what? In our office, and we do CT scans, and all the time the CBCT scans we call them. Those scans are three-dimensional diagnostic aids, and we should be able to see how close the tooth is sitting to the nerve, or whether it is traversing through the nerve or not. We should be able to see that on the CT scan.
Mm-hmm.